Everything you need to know about vaginal discharge. Vaginal discharge is most often a normal and regular occurrence. However, there are certain types of discharge that can indicate an infection. Abnormal discharge may be yellow or green, chunky in consistency, or foul-smelling. Yeast or a bacterial infection usually causes abnormal discharge. If you notice any discharge that looks unusual or smells foul, see your doctor for diagnosis and treatment. Types of vaginal discharge. There are several different types of vaginal discharge. These types are categorized based on their color and consistency. Some types of discharge are normal. Others may indicate an underlying condition that requires treatment. White. A bit of white discharge, especially at the beginning or end of your menstrual cycle, is normal. However, if the discharge is accompanied by itching and has a thick, cottage cheese-like consistency or appearance, it's not normal and needs treatment. This type of discharge may be a sign of a yeast infection. Clear and watery. A clear and watery discharge is perfectly normal. It can occur at any time of the month. It may be especially heavy after exercise. Clear and stretchy. When discharge is clear, but stretchy and mucus-like, rather than watery, it indicates that you are likely ovulating. This is a normal type of discharge. Brown or bloody. Brown or bloody discharge is usually normal, especially when it occurs during or right after your menstrual cycle. A late discharge at the end of your period can look brown instead of red. You may also experience a small amount of bloody discharge between periods. This is called spotting. If spotting occurs during the normal time of your period, and you've recently had sex without protection, this could be a sign of pregnancy. Spotting during an early phase of pregnancy can be a sign of miscarriage, so it should be discussed with your OB/GYN. In rare cases, brown or bloody discharge can be a sign of endometrial or cervical cancer. It could be other problems such as fibroids or other abnormal growths. This is why it's important to get a yearly pelvic exam and pap smear. Your gynecologist will check for cervical abnormalities during these procedures. Yellow or green. A yellow or green discharge, especially when it's thick, chunky, or accompanied by an unpleasant smell, isn't normal. This type of discharge may be a sign of the infection trichomoniasis. It's commonly spread through sexual intercourse. When to seek medical help. If you have unusual discharge alongside certain other symptoms, see your doctor as soon as possible. The symptoms to watch out for include fever, pain in the abdomen, unexplained weight loss, fatigue, increased urination. If you have any concerns regarding whether a discharge is normal, make an appointment to see your doctor. What causes white discharge before your period? Possible causes for white discharge before your period include normal reproductive system functioning. White discharge before your period is a normal part of the menstrual cycle. Normal discharge at this stage of your cycle is sometimes called egg white mucus because of its thin, stretchy, and slippery texture. This discharge is also odorless. Birth control. Birth control changes your hormone levels, which can lead to increased discharge. This is a normal side effect of hormonal birth control. Pregnancy. Discharge before you are supposed to get your period can be an early sign of pregnancy. Discharge from pregnancy can be hard to tell apart from discharge that is just part of your monthly cycle, but it is usually thicker and creamier than normal discharge. A sexually transmitted infection. Gonorrhea, chlamydia, and trichomonas are the most likely to cause discharge. If you have gonorrhea or chlamydia, Discharge will be more yellow and pus-like. However, these tests are often asymptomatic. Trichomonas is more likely to lead to symptoms, including greenish or yellowish, fishy-smelling discharge and itching. Yeast infection. Yeast infections are common and can occur with no known cause. However, antibiotic use increases your risk of getting a yeast infection, and they are most likely to happen right before you get your period. Discharge from a yeast infection is thick and white and is often described as looking like cottage cheese. Yeast infections also usually cause itching and burning in your vagina and vulva. Bacterial vaginosis. Bacterial vaginosis is an infection that occurs when the natural balance of bacteria in your vagina changes. The cause is unknown, but it's been linked to smoking, douching, having a new sexual partner, and having multiple sexual partners. Discharge from bacterial vaginosis will have a fishy smell and a grayish-white color. Home care for vaginal discharge. To prevent infections, practice good hygiene and wear breathable cotton underwear. Don't use douches, as they can make discharge worse by removing useful bacteria. Also, practice safe sex and use protection to avoid stis. To decrease the likelihood of yeast infections when taking antibiotics, eat yogurt that contains live and active cultures. If you know you have a yeast infection, you can also treat it with an over-the-counter yeast infection cream or suppository,